My name is David Cowan, and I live in Woolwich. I'm the parent and guardian of an adult son with intellectual, mental health, and other disabilities. I and the Mainers gathered here today appreciate your willingness to cover such an important issue that affects hundreds of our fellow Mainers. This morning we attended a hearing at the Department of Health and Human Services to voice our objections to new rules that would change the way services are allocated to adults with intellectual disabilities and autism. The new rules for services for adults with intellectual disabilities and autism have very serious flaws. I am joined today by other families who share the concern that these proposals from DHHS will have a significant negative impact on Maine citizens who have intellectual disabilities or autism, as well as their families. Our first speaker is Debbie Dion of Georgetown. Debbie is the mother of a nonverbal adult daughter with cerebral palsy and osteoporosis. Debbie?
Thank you, David. I oppose the draft rules for the home and community-based services for adults with intellectual disabilities and autism because I believe that the changes that have been proposed will place the most vulnerable and whose CIS score does not adequately represent their service needs at high risk for serious, possibly permanent injuries and decline. I do not believe that this one high-stakes CIS test adequately assesses our family members who have grave physical, communication, and behavioral needs. Communication barriers crucially impact the amount and kind of support needed by a person with an intellectual disability. The ability to communicate effectively with others should be addressed in the Maine CIS and in the scoring metric as it is in some states, such as Pennsylvania. I believe the estimate of support needs will be seriously inadequate without this change to the CIS assessment. I'm the mom of a 36-year-old, vibrant young woman who's been receiving waiver services for the past 14 years. Kate has a diagnosis of cerebral palsy and an intellectual disability. Kate is also nonverbal, uses sign and gestural language along with limited spoken language. She has recently begun to communicate using an iPad and a communication app. Kate has had major reconstructive surgery on both legs so that she can continue to walk, but still has very poor balance and needs a walker at all times. Kate has also been diagnosed with osteoporosis and most recently with early onset arthritis. She needs assistance walking up and down stairs, getting in and out of cars, as well as making any other kind of transition. Kate needs help with toileting, showering, and struggles most embarrassingly with incontinence. Over her short lifetime, Kate has experienced many face-first falls, resulting in serious injuries to her jaw, a broken nose, broken teeth, and shattered crowns, over and over again. Kate cannot spend any time alone, unsupervised in her group home, is unable to write or independently use the phone, prepare meals, and needs help cutting up her food. Sadly, because Kate's language is not always understood, she can become extremely agitated, frustrated, and depressed. At one very low point, Kate refused to eat food and chose to go to bed as her way to get someone to understand that something was very wrong. She is most vulnerable and is unable to advocate for herself. Thankfully, because of her caring, knowledgeable, person-centered planning team, we've been able to work together with Kate to create a plan that has addressed all of her unique needs. Kate is currently happy, confident, and safely immersed in an active community and day program, successful at her job and integrated into her supportive community. I attribute her successes to the PCP process and team who has worked together to create an outcome-based plan designed to help Kate overcome obstacles with the most appropriate supports. If the rates change and a reduced level of staffing is put into play, Kate will get far less support and her safety will become severely compromised. I see a potential for a life-threatening situation that could result in a hospitalization or permanent injury for my daughter and for many others who will also lose those crucial supports and staffing. Is this the supporting individual success outcome DHS is really striving to achieve?
He's taking off his belt. He'll be right in.
All right. So we'll just pause for just a minute. Dougal of Wiscasset. Anna is an individual self-advocating for her community of individuals with intellectual disabilities and autism. Anna?
Hello, my name is Anna McDougall. I live in Wiscasset. I oppose these rules. People with disabilities are not a fifth number. We've been labeled all of our lives. We are not a school or a number. We have a voice. We have feelings. We are people and individuals. I'm concerned about cutting the services. We need services that we depend on every day. I go to Cinderella Monday through Friday. We do weaving, woodworking and pottery, and painting. It's like a family veil. We are important part of the, it's like a family veil. We are an important part of the community in Brunswick. I have friends that do other programs that are important to them. I don't want to see anyone get cut. We need our routines. It's a heartache on us, on everyone. Some of my friends are here today. I am speaking for all of us. Please don't make these changes that could cut our programming. It's a big part of our lives and we love what we do.
Thank you. Our next speaker is from Auburn. Kim Humphrey is the mother of an adult, nonverbal son with autism.
Hi, I'm Kim Humphrey. I'm a parent and guardian of Daniel, a young adult with autism living in a home run by John F. Murphy Homes. I oppose the Section 21 Home and Community-Based Service proposal. Daniel is expanding skill development and independence. He recently acquired a second volunteer job and will work 3 times a week. Quite an achievement for him. He loves and is welcomed into the community. He deteriorates rapidly into an uncivilized way of life with aggression and skill loss if supports are inadequate. I anticipate this will happen if the new rule is implemented. Under the new rule, the person-centered planning process we have now, which focuses on individual success, is being replaced with a policy that uses one formula based on one assessment to generate one score to correspond to one budget. There's only one safety valve to compensate for those who do not fit the new equation, and the Qualified Extra Support Service, QESS, safety valve remains untested with stakeholders pointing to serious flaws. It's unclear if QESS will be granted when needed, if there are workforce available to fulfill it, or if agencies can afford it. If QESS is used, costs will rise due to higher reimbursement rates. If it's not used when people need it, people will be unsafe. Community hours are limited to 30 a week. For safety reasons, Dan needs 2 staff, cutting his community hours to 15. He and others will be effectively housebound and hidden in a horrible leap backwards for Maine. Many of us urge Oates to pilot the proposal before exposing an entire population to potential harm. The proposal formula is simple, but the delivery of services is complicated and happening concurrently with too many other major changes within Oates. The rule does not define success, and is largely moving forward without outcome measures. As service agencies struggle to absorb the cost of the higher needs individuals who do not fit the new formula, the most fragile and defenseless will be using emergency rooms, hospitals, jails, or will be pharmaceutically controlled or homeless. There is no contingency plan built in to prevent this. The ensuing service system chaos will prevent reducing the waiting list. Everyone will lose. Many of us have tried to convey these concerns to ODES. We've been present with ODES on weekly calls, regular meetings, and regional forums, and our input was largely ignored within these new rules. Furthermore, ODES did not respond to a letter highlighting common issues about the proposal signed by over 330 people in September. We requested more dialogue before the rule went into public comment period. The response from ODES was to schedule the public hearing over the holidays when people are unavailable, underscoring the perception that they have not been interested in input from families. It's not too late. We are working towards the same goal, to ensure the health and well-being, safety of Mainers with intellectual disabilities and autism as they participate in their communities. We urge DHHS to protect the most vulnerable people in our state from harm by shutting down this proposal until major adjustments are made.
And now I'd like to invite another Kim to the podium. Our last speaker is Kim Christensen from Albion. Kim?
Thank you so much. My name is Kim Christensen, and I am here to speak up for other people who can't speak for themselves. I am a person who can do a lot of things on my own. It is not right to cut things. I should be able to come to programs no matter what the money is. This is a good program for me to go places and do things here. I learn things here. I learn the skills I need to do things on my own, like have a show on my own, other work. Without day program, I won't be able to do things that I need, like go to stores or go to programs like food. It is important for me because I express my rights and I am able to go to get their help that I need. That able me to speak up and not be afraid. How do they know how I feel? Listen, how can you define what you don't know what it's like to have a disability? You don't know what it's like to not be able to do things on my own. If I don't have those things, I will not be able to be intended and go and learn. My headmaster knows me the best and knows what I need. The fifth interview does not know me or what I need. I get nervous when people are asking me questions and you can't get an idea from me when I can't count it. Thank you.
The stories that you've heard from us represent hundreds of Maine citizens with intellectual disabilities or autism and their families who spend every day confronting the challenges of living with a disability. To summarize our concerns, the SIS is a high-stakes test with high-stakes implications for Mainers who have autism or intellectual disabilities. One test alone should not be the sole determinant of what services a person with intellectual disabilities or autism receives. Individuals with intellectual disabilities or autism who require continuous day and night support due to their significant health or behavioral challenges will likely have some of their very services that have allowed them to be safe and successful either curtailed or even eliminated. Will these individuals and their families have to face emergency situations and an already burdened crisis response system before adequate supports are reinstated? At what cost to the state, not to mention the individuals and the families involved? The terms intellectual disability and autism cover a vast range of ability and impairment. Those involved need a range of appropriate supports in order to live what many of us think of as just normal lives. Under the proposed rules, this broad continuum of needed supports is whittled down to officially 5 categories, but what is in reality merely 3. We urge the department not to move forward with these rules that could harm individuals with intellectual disabilities or autism. Thank you for your time and attention, and we'd be happy to answer any questions you might have.
This has already taken this SIS test. Could you explain why that is? And if that's accurate?
There's a professional organization called the American Association for Intellectual and Developmental Disabilities. They put together a strengths-based assessment called the Supports Intensity Scale a number of years ago that was a tool to be used to try to assess the kinds of supports people with disabilities need on a weekly, hourly, daily, minute-to-minute basis. It is one type of assessment tool that the state has basically taken as the sole determinant of how much money can go to an individual for providing services. And I would say at this point, there are many hundreds of people who have already taken the SIS. I'm not sure exactly what that number is. I would say most people who qualify for these services that we're talking about have taken the SIS. Many people are not pleased with the results of that assessment. They don't feel it was an accurate measurement at the time that it was given. And the state is allowing for opportunities to retake that test. But there's a substantial time lag oftentimes in having a second assessment. And I think it's hard to minimize the amount of stress and worry that families have when their services are questionable.
Do you know when these tests started to be administered in Maine? Was it recently, or has this been long-standing?
There was a pilot on 500, I believe, individuals 2 years ago, and since then, additional testing has been done to cover most of the people eligible for services. But Mary Lou Dyer might have more information.
You're absolutely correct, David.
I want to reiterate that they do not go back more than 3 months. They do not take an individual's history into account. So therefore, if they're getting therapy that is effective, their points will be lower. My son went down a whole level because his therapy was effective. But they will not take into account a person's history. And as a nurse, we do that. When we interview a patient, we take their history. They void that right out, and I feel that needs to change.
An additional problem is that, as well as being the solitary tool that determines services, other states that use the SIS have 8 different funding levels based on the results of SIS testing. The state of Maine decided to go with 5 levels, but 2 of those levels are identical. So what that means is there's basically 3 levels of funding unless you go through an elaborate process called the QESS to determine additional services. And even if you go through that process, there's no guarantee that the funding will be in place that allows you to maintain your current level of service, especially for people with very significant behavioral or medical issues.
There was mention about Pennsylvania model. Could you describe the differences between what Maine is doing or is proposing and what Pennsylvania has for their eligibility and standards?
There might be somebody here more knowledgeable about that than I. If not, I'll give it a go.
The communication piece was factored in, people that were nonverbal, into the SIS that's given in Pennsylvania. It is not. So if someone is nonverbal, that piece is a really important piece.
Okay.
And my daughter couldn't answer questions for herself. So it was left to the interpretation of the people that work with her and me. But even then, I felt coerced or coached because she had such good support, as I just heard. Her score came out much higher than I really feel it should have been.
So when these tests are being administered, are the individuals allowed to have some support in answering the questions or going?
Yes.
So they have family or caretakers who are helping
Yes.
give some of the background and history of the person being tested?
Not the history.
Oh, okay.
The individuals don't even have to be there. They have to meet the interviewer, but then they can leave the room. They don't have to stay for the whole assessment.
It takes 3 hours.
And the thing is that the system was not broken. Like Kim here said, her case manager knows her. And in the situation of my sister, her family and the staff that work with her know her. We know what support she needs. There was not a problem with that. The problem is the budget. This is a way to slice one pie into smaller and smaller pieces. That's the bottom of the situation here. And if you look at, I was looking on the web, the CDC data and statistics said the prevalence from 2000 to 2010, the prevalence of autism in U.S. children increased by 119.4%. This problem is not going away. We can't keep slicing this pie into smaller and smaller pieces. We need a bigger pie, or we're going to have a lot of traumatic situations, as people here said in the room earlier.
You have to retake it again, too. But another retake, which I do not like, but we have to, you know, but it's hard that we have to retake it again. Even though I don't want to, but we have to.
David, could you speak on one thing? What impact would this have on a person's daily life? So, give an example of somebody's personal daily life and the result of the CIS on the support that they receive, as well as the health impact that it might have on them, and the safety impact upon those who are being served, as well as those offering the service.
I think at the hearing this morning earlier, there were people much more eloquent than I that could describe the impact on their services. And Hans, I don't know whether you'd be willing to speak to the impact that it might have on your family? Or...
Sure. Hi, my name is Hans Olsen. I'm the father of Gunnar and Ansel Olsen. I have 2 boys in the system, 2 boys who have scored level 5, so that's the most intense scale. My younger son, Ansel, who gets something on the order of about 207 hours a week, will have his hours cut 55%. My older son, Gunnar, will have his hours cut something on the order of 35%, which is about 50 hours. My sons, as charming as they are, have intense needs. They have a very rare metabolic disorder, probably the rarest you can possibly get. They are 2 out of a global population of 10 right now that is known with this rare disorder. And their needs are extensive. They're not 9 to 5 disorders. They're 24/7 types of needs. My sons can't bathe themselves. They can't feed themselves. They have no sense of personal safety. They could not take their own medication. They need help toileting. And if these services go away, if these hours go away, and this all falls under this CRESS scheme, where it is mathematically designed to fail. The tenure hours under CRESS says that in order to get the additional hours, you'll need staff with at least 3 years of experience, plus a whole fistful of other qualifications. Now these qualifications and this tenure requirement is with a population in the labor market that has a very high turnover rate, somewhere between 40 to 50% per year. So do the math. Every year you lose half the cohort. At the end of 3 years, you're left with 12% of what you started with. You'll never be able to deliver the services. It's designed for failure, exquisite failure at that.
Expensive failure.
Expensive failure. And you know, the hope for all of us really is for all our children to have productive and meaningful lives. And what we really want now with these cuts is to make sure that they have a safe life so that they can be a part of the community. And we're always here. Sometimes you don't see us. It's easy not to see us. But we're here. We've always been here. We'll always be here. So, you know, while there's a lot of other things in the news right now, please pay attention to this. These have incredibly important implications for this community and a lot of others. Thank you. Other questions?
I think that some of the people who are viewing this later might wonder why you don't just appeal the level. It might be good to see
I think based on what I heard at the hearing this morning, there's real questions about due process and the grievance and appeal process. And there's a lot of confusion about in what order that would happen and what procedures you go through to make that happen. So although it's a tool that might be available, I think it raises lots of questions about how you go about doing it. Mary Lou?
Good afternoon. My name is Mary Lou Dyer, and I'm the Managing Director for the Maine Association of Community Providers, Community Service Providers. And it is true that in this proposal, there's the ability to grieve and appeal. The fundamental problem is that you look at the full scheme of how these services are going to flow, and it's still not clear how an appeal will be helpful. There's too much there that's unanswered for me to say to a parent, well, once this is in place, once you're told what the final rate is, you can appeal it or you can grieve it. There's too much that goes before that that's in this proposed regulation that is really, really scary and unanswered at this time. Thank you.
We got a retake, but you get the same result because of the flaws in the process.
Anybody else have any questions? Thank you so much for coming, and thank you everyone here for coming for this morning.
Thank you. Open the waiting list without increasing the funding. How were they going to do this? Well, they decided they were going to interview each and every individual who would benefit from these waivers and give them a special number. And the problem is that they give you a number and only take into account the past 3 months. If a person is getting therapy that is effective, their score is going to be lower than if they would been prior to getting the services. If they were to take into account my son's history, his score would be a lot higher. But I kept going back and saying, well, before, this is what we had. Charlie had so many issues, but now, because it works, he's doing really well. He's living in his own apartment. He's a photographer. He does not have all the psychiatric issues because he's autistic and they know what they're doing with him. To take these services away, to limit them because they have to accommodate these other individuals who should be served, I don't know if it doesn't make any sense.